Hello, my name is Veronique Cyr. I'm a registered nurse enrolled in the Masters of Nursing program at Athabasca University. Today I will be debating that harm reduction programs are a medically necessary healthcare service. I will be debating the pro side of this topic. This is the first video of 3 parts of debate. I will be posting my rebuttal to my opponent in a few days and a final video after that. So first, let's begin with the definition of harm reduction. The Canadian Mental Health Association defines it as an evidence-based, client-centered approach that seeks to reduce the health and social harms associated with addiction and substance abuse, without necessarily requiring people who use substances from abstaining or stopping. For this debate, we will be focusing mainly on the topic of drug-related harm reduction methods. So here's a quick outline of the debate topics for today. Harm reduction programs are medically necessary because they provide healthier outcomes for clients. People with drug dependencies can be treated on an individual basis through specialized clinics with free drug alternatives. And finally, harm reduction programs positively impact the healthcare system by lessening the burden on healthcare workers. Harm reduction programs will have positive impacts on people's health. These programs offer safe administration sites to the community where clients can safely use drugs under the supervision of a nurse, and they can recycle their needles securely. Harm reduction programs increase the uptake into addiction treatment centers while offering them medicinal options to wean off street drugs. Also, these programs will educate the population about needle sharing to help prevent the spread of bloodborne illnesses such as HIV and hepatitis. So here are some examples of the program's impacts on health incomes. So Insight is North America's first safe injection clinic that opened in Vancouver in 2003. That clinic has effectively increased addiction treatment intake and prevented approximately 2 to 12 deaths per year. Methadone maintenance treatment clinics allow fewer barriers to delay access to care while retaining patients with no mandated urine tests, counseling, or punitive measures for not following the rules. Needle sharing education has shown that those who use these clinics are 70% less likely to report sharing than those who don't use the facility. These people are significantly less likely to inject or contribute to injection-related litter in public as well. Some of the social aspects positively impacted by harm reduction programs are helping those struggling with drug abuse and dependency. These programs will inevitably lead to fewer accidental overdoses and deaths. Lastly, harm reduction aims to continue supporting people trying to change their lifestyles. Dueling and Rachlis found that being part of a treatment program offering free opioid alternatives have resulted in fewer relapses into opioid use. Some alternatives include methadone, bupropion, naloxone, and morphine. Some methadone clinics have a 95% retention rate in the program after 1 year. Bupropion naloxone is another option that has much fewer side effects than methadone. A newer option that has been found is slow-release oral morphine, which is better at controlling withdrawal symptoms, reduces cravings, depressive symptoms, and helps with physical pain and anxiety. The third topic I would like to touch on is harm reduction programs' impacts on the healthcare system. These programs will help relieve the financial and physical burdens on healthcare by diminishing the increasing number of drug-related deaths and reducing the number of drug-related hospitalizations and emergency response calls. A good example of harm reduction programs' positive impact is the Insight Safe Injection Clinic in Vancouver. That clinic has saved over $18 million since it opened in 2003. In recent years, there have been an increasing deaths from opioid overdose. To prove that opioid-related harms have huge impacts on the healthcare system and have only increased in recent years, the Public Health Agency of Canada started scrutinizing drug-related data in 2016. From 2016 to 2022, there have been over 34,000 deaths and over 34,000 hospitalizations. More specifically, between January and September of 2022, there were approximately 20 deaths and 14 hospital admissions per day from opioid toxicity. In 2022, more than 28,000 emergency medical services responded to opioid-related overdoses. This data proves that the system needs programs to promote primary prevention methods like harm reduction strategies to reduce the burden on the healthcare system. In conclusion, harm reduction services are medically necessary healthcare programs because they provide essential services to keep people healthy, such as safe injection sites. They promote safe and secure complementary therapies, such as free opioid alternative medications, and they help relieve the financial and physical burden on the healthcare system by preventing accidental opioid-related overdoses and deaths. This is a list of the references that I used to compile the evidence for this debate. I will be linking the other two parts of this debate in the description box below once they have been uploaded. You can also find all the links to my presentations on my ePortfolio website, which is linked here. And thank you so much for listening to this presentation. I look forward to your feedback after the next video. Have a nice day.